On any given day, this is where you'll find Consuelo Avalos, breaking a sweat, lifting weights, and doing cardio. Like many of us, Avalos packed on a few quarantine pounds she's anxious to get rid of.
Me gusta mucho caminar.
I really enjoy walking, and during the pandemic, I gained more than 5 pounds. So for me, it was necessary. And I saw this program at Camino Vida.
Avalos joined the program at Camino Vida after suffering from high blood pressure. Paulina Martinez is her fitness trainer.
Con eso van a grabar.
She says weights intimidate many of her newcomers,
That's 8 nada más.
especially women. Martinez works to put them at ease.
Most of them, they're either not exercising at all or they're doing the wrong thing. So most of them, if they go to a gym, they're just doing treadmill for like 40 minutes. And so their body gets used to that and they're not seeing any changes. And then when they get here and they start working with us, they just kind of learn a lot of different exercises.
As a mother and grandmother, 56-year-old Avalos says it's important to her to stay healthy and active for her family. Here, she's found the support she needs to learn how to eat and work out properly.
I feel so much better. I learned how to eat better, how to know what to eat, what to buy, what to eat at the house, what portions, and the other thing that's important, exercise.
A health and wellness program, Camino Vida, is part of the Camino Clinic's efforts to address health issues in the Latino community, including diabetes, high cholesterol, and obesity.
The program was developed specifically for patients of Camino Clinic, and primarily the clinic serves Latino first-generation immigrants that primarily speak Spanish. And so what we were finding is that a lot of patients were coming in with high blood pressure.
The new health center includes a state-of-the-art gym and kitchen where clients enrolled in the one-year program work with a nutritionist to learn what to eat and how to prepare healthy meals.
I am Panameña. My parents are from Panama, so I really like working with the Latino community. I like being someplace where I feel like it's appreciated and it's more like a family and it doesn't really feel like work, like I'm doing work while I'm here. So I really enjoy like the community feel, the family feel, and just being able to connect with them on a different level that includes food, which I love.
That personal insight into the Latino culture helps Taylor develop nutritional plans incorporating ethnic foods.
Because when you think healthy, generally you're thinking like a green salad or like a parfait, and that might be something that you're totally not used to eating, especially as a Latino. For example, we have a lot of population who eats like squash, like chayote or nopales. Those are very nutritionally rich vegetables that they can continue to eat in their diet, and it doesn't have to be like a green salad.
The program is paying off with improvements in weight loss and lower cholesterol levels.
We're also seeing improvements in A1C and their blood pressure and all those other things as well. And so we're definitely seeing the results in the data. And individually, I think that primarily what we see a lot of is that they have improved self-esteem.
Camino Vida is one of 4 areas at Camino, a nonprofit. The center also offers a behavioral health program, an upward mobility program focused on employment and financial services, and a food pantry. The community also has access to an on-site thrift store.
We've made a good attempt at trying to, bring in bilingual professionals in all the areas, but I don't believe that the capacity has grown with the growth of the Latino population. So we are more overwhelmed today, even though we've got greater capacity than we were at the beginning because the need is so great.
Rusty Price launched the Camino Center in 2003 after serving internationally on missions trips.
And so I just said, we've got to do something. And we'd already started the nonprofit, but we were focused more internationally. And so that's when we decided to start the clinic, and the clinic was born.
What started with just a handful of volunteers has grown from 25 employees just a few years ago to more than 85 employees. Rusty says today the need is even greater.
The specific needs there's these gaps between the broad community and then the Latino immigrant community. And we've figured out how to be a bridge and how to do that. So now we're looking to scale across the state and even out to other states and take what we've learned and hopefully be able to influence or start other programs just like Camino in other places.
Cerrar este aquí. con los brazos derechos, sin doblar, para pasar al otro lado.
For Avalos, being in an environment where she can feel seen and heard has made all the difference on her journey to healthy living. For Carolina Impact, I'm Sarah Colon-Harris reporting.
We hope you enjoyed the story. If you don't want to miss any more great stories about the Charlotte region, please subscribe to our YouTube channel.